I'm Jeremy, and on this week's edition of Neuroscience Weekly, we're going to be discussing something that I think is critically important. And I want to start this discussion with a question. If your mind controls you, what controls your mind? Let's let that sink in for a second, the depth, the gravity of that question. And I posed this to our Facebook viewers and got some interesting responses. Everything from aliens and vampires and wizards, all the way up to something maybe more acceptable. Values, emotions, surroundings, the media. But I would say that if you to control your mind, you are ultimately in control. But that's not always easy, obviously. So the intervention we're going to be talking about today, mindfulness, is something that can definitely help you get control of your mind. It's all about paying attention on purpose to the unfolding experience, moment to moment. And it sounds easy enough, but how often are you distracted either by thoughts of the past, kind of ruminating, or planning ahead and kind of future tripping, as some people would say, or even numbing the mind through chemicals or distractions through social media, or trying to constantly escape boredom or negative emotions. So mindfulness helps overcome those with taking a curious, accepting, non-reactive and non-judgmental stance towards the current moment. It's not pushing away, not clinging to anything, just letting the moment unfold as it is. So you can consider the a blanket in an open field. It's going to accept whatever falls on it. Leaves, inattentive passerby's footsteps, dogs running across it, bird droppings, rain, whatever it is, it's going to accept it. So where does mindfulness-based interventions fit in on the, I guess, in the pantheon of interventions? It's part of the, Gerald Corey describes it as the third wave of behavioral science in that tradition, which has all the evidence to support it that you would expect with those. So similar to cognitive behavioral therapy, it targets thoughts, behaviors, and emotions, but in a way that is not so much restructuring your thoughts and emotions, but your relationship with them so your behavior changes. And this is no hippie stepchild of the behavioral tradition. There are multiple evidence-based practices to support it, and a broad range, maybe even more broad than the behavioral traditions in terms of what it's applicable for, which we'll get to. But there's dialectical behavioral therapy, a personal favorite of mine by Marshall Linehan, University of Washington researcher. Mindfulness-based stress reduction, that comes from John Kabat-Zinn, one of the guys who started the, I don't know if I mentioned, but he's the guy who got the quote about mindfulness. And mindfulness-based cognitive therapy and acceptance and commitment therapy. And all these embrace facets of mindfulness in terms of embrace aspects of mindfulness that were previous, or cognitive behavioral therapy that were off limits. Reality acceptance, spirituality, values, meditation, the here and now, emotional expression, and all of those really do help people cope with a wide array of things, which I will again get to here in a moment. So what are some techniques and principles that you can use with mindfulness, or that fit in with mindfulness? I like to use the expression nope, in this moment, do mindfulness. So it's a two-part one, and this has been adapted from work by Marshall Linehan. But anything that you can do non-judgmentally and one mindfully while participating effectively is, in this moment, is a mindfulness practice. And when in doubt, just describe and observe. So non-judgmentally, one mindfully, participate effectively, and when in doubt, just describe and observe the current moment. And it's simple, but not necessarily easy. So to demonstrate, or I guess give a good example, is observing the breath. We're constantly breathing all the time, but we're hardly ever aware of what is actually happening. So if we take a nice deep breath in, you'll notice that as you breathe in through your nose, you'll feel the kind of cooler air on the outside of your nostrils and in through your nasal passages. You'll feel your chest expanding, and then as you exhale, you'll feel the warmer air being expressed or exposed, getting out of you. Expelled is the word I'm looking for. and your kind of tension being released a little bit. And in addition to that, another simple one is mindful eating. How often do we really take a second and slowly, deliberately feel the texture, the temperature, the taste, the smell of what we're eating, kind of the full culinary experience. You can do this while participating in your favorite hobby, whether that's guitar or crocheting or tennis or basketball. Observing an object is kind of focusing on an object, and a personal favorite of mine is cloud gazing, just kind of laying in a field and watching the clouds, or maybe not even laying down, just sitting down and watching the shapes as they form and describing them, watching them go away, and those are all perfect for getting in the here and now. So it's all about freeing your mind in a way, being present for the whole experience of what's happening right now. And what tends to happen with that is the worries fade, nothing else really seems to matter, and you realize that everything is as it should be. So what populations and settings is this applied in? Pretty much everywhere, for everyone, to address almost everything. So life coaches have used this for various things. Nurses use it to fight, to decrease burnout and stress on the job. Teachers use it for the same reason, and also implementing it in the classroom for kind of improving the overall educational experience. Couples parenting children with disabilities use it to kind of make the relationship better and kind of cope with the stress of that as well. In terms of mental health issues, pretty much all of them: bipolar disorder, depression, trauma, ADHD. Studies have shown that even intervening early with psychosis with mindfulness can be effective. Paranoia, hearing voices to some extent. Obviously addiction is embraced it big, helping people with mental health issues and even intellectual disabilities quit smoking. It's been shown for that. Eating disorders, I think it said bipolar and personality disorders, certainly they work there. Criminal behaviors in correctional settings it's great for. Even physical health problems, chronic pain, chronic fatigue, coping, even helping with coronary heart disease, people with intellectual disabilities, the elderly. It's truly, like I said, everywhere for everyone. So if you think about what problems mindfulness can help with, anything that has to do with the mind, and if you really think about it, all problems boil down to a problem with the mind, or at least an issue. So, as I said, the settings that it's applied in are very broad as the symptoms that it's, or illness elements that it treats. Counseling sessions, substance abuse treatment, psychiatric settings, correctional facilities, hospitals, pain management clinics, oncology, in the classrooms, life coaching, supported living, retirement communities, palliative care, in family homes, on the job. The list is growing and is quite inclusive. So with mindfulness, it will help just about all issues of the mind, as I said, and is applied where people might go. Pretty inclusive and amazing, if you ask me. So specifically, people have asked about, well, what about adolescence and their impulsivity and lack of future planning, and then what if we throw depression on top of that? Well, I would say clearly adolescents can be learned to control their mind as well, and there's some considerable risk factors to consider with this group. Suicide is a big one, obviously. Substance abuse, low self-esteem, self-confidence, self-efficacy, the struggle with goal attainment, delinquent behavior, decreased relationships or even positive relationships, and overall a diminished sense of well-being. And the protective factors with adolescents, particularly with intervening with this, is they're going to be perhaps more open to trying it out. And if you can intervene early and kind of give them the base of mindfulness, something to kind of positive habits, then you're obviously going to decrease the risk of suicide and substance abuse and all the other negative attributes or risk factors of being a teen with depression. But you'll also increase resilience and improve relationships and overall improve the chances of future outcomes. So it's definitely been shown to be positive for co-occurring disorders in terms of attention, behavioral issues, substance abuse, learning disabilities. So like I said, this can start the foundation of a positive life for adolescents. And so in conclusion, I tried to condense a very broad topic into less than 10 minutes or so, but you're strongly encouraged to investigate further and integrate these practices into your toolbox. I might even go one step further and say it'd be unethical to not have this in your toolbox just because of the broad array of applications for the populations. Pretty much anywhere you are, you can benefit with mindfulness having it in your toolbox, and for longevity's sake, for your own self-care. So I'll send you off with a tip or a quote from the infamous Anonymous. Be aware of how you're spending your 1,440 beautiful moments and spend them wisely. Thank you.